Deaths from the novel coronavirus in the U.S. are quickly approaching 150,000, the highest level in the world, according to Johns Hopkins University. This comes as a handful of states, including Florida, Oregon, and Arkansas, report their largest one-day death toll to date. Laura Podesta has the very latest.
The nation's second largest teachers union says members can go on strike if returning to school isn't safe. These teachers in South Florida are protesting an August reopening.
We want to be with our students, but we also know that we have to put the safety of ourselves as teachers, our students, families, and the entire community first.
186 people died from the coronavirus in Florida yesterday, the state's deadliest day yet.
ICUs, they're all full. We are finding ways to MacGyver things, running out of supplies.
White House health experts have a warning for states that haven't seen major outbreaks yet.
We can see the virus moving north.
In Ohio, Kentucky, Tennessee, Indiana, that inkling of a % increase of cases that are positive, that's a warning sign that you might be seeing a surge.
Dr. Anthony Fauci says those states need to take action, like closing bars before they become the next Florida, Texas, or Arizona.
They've really got to jump all over that.
Major League Baseball has jumped on its outbreak, suspending the Miami Marlins season after more than a dozen players and staff tested positive.
Even with all of these resources, there's still transmission going on.
MLB Commissioner Rob Manfred says owners have not yet considered canceling or suspending the whole season. Laura Podesta, CBS News.
All right, we want to bring in Dr. Dara Kass, or rather Dara Kass. You are an ER doctor and a medical contributor for Yahoo News. Doctor, we are seeing cases rise across the country, but sometimes it's difficult to determine exactly what we're seeing with all these different statistics being thrown at us. An increase in cases, but there has been an uptick in tests, an increase in hospitalizations, but there's also an increase in deaths. Or what about the people that have recovered? It's difficult to know exactly what those numbers mean. So as a doctor, I want to ask you, what are the numbers that are the most concerning to you?
So what I tell my friends and family all over the country is to look at your community and look at basically three things, right? You want to look at your positive test rate, not your overall number of tests, but your positive test rate, right? So knowing that less than 5% of positive tests is the number we're looking at to open schools. You want to look at your hospital capacity. How many hospitalizations are there, for patients that have coronavirus? And more importantly, what does your ICU capacity look like? Those three numbers together basically tell you the landscape of what's happening in your community, because it tells you kind of how sick the patients are and is there room for more patients if they get sick in your community. We're seeing in Texas and Arizona and Florida, 100% of all the ICU beds are taken, and their positive test rates were as high as 25%. That's a real indication that things need to be shut down and that people need to stay home for a while to get those tests under control. The number of total tests can actually be very distracting because we're going to keep testing people over and over again, and the test is really only as good as the day or the 2 days around the time frame it's done in.
Doctor, let me ask you about hydroxychloroquine. As you know, the president has been advocating for the use of hydroxychloroquine as a treatment for COVID-19, which contradicts some of his own public health officials like Dr. Anthony Fauci. Even the FDA, the Federal Drug Administration, has said that it has not been proven to be effective against COVID-19. But let me just ask you to put some context into this. If a patient comes to you and they're infected with this virus and they're worried about it and they say, look, I'll try anything because I want to survive this. And there are some people, some doctors who say that this works. If I'm willing to sign a waiver or acknowledge the risks inherent in taking this treatment, I guess I can understand where people might say, well, I'll try anything. Why wouldn't we not make everything and anything available to patients who are fearing for their lives if they become infected with this virus? But I guess it's important for you to remind us what the FDA and the World Health Organizations and others like Dr. Fauci say about using this particular drug to treat coronavirus.
Right. So there are numerous studies right now looking at the use of hydroxychloroquine and other medications in every single phase of illness, whether it's prevention, early stage, like when somebody's diagnosed at home, early intervention in the hospital, and then late stage intervention when someone's critically ill. And all of those studies are undergoing in a double-blind, placebo-controlled way that we can get the best evidence out there. Unfortunately, when patients see the news or these, press conferences with more press conference, speakers than necessarily attendees, they get confused on the information. And because people are so afraid, it is a really dangerous, kind of landscape for patients to ask for medications that are not entirely understood in the context of this disease. Remember that even if a medication is 65 years old, we don't know how it acts entirely with patients that have this particular disease, which is why the FDA currently does not recommend patients taking the hydroxychloroquine for either prevention or early treatment for this disease. And unfortunately, this morning, we just saw Kylie McInerney say that the president recommends it for prevention. There is absolutely no indication at this point from the FDA that there should be a recommendation that hydroxychloroquine should be taken for prevention of the coronavirus, COVID-19.
Yeah, and I think earlier today, too, we heard the president say before he headed off to Texas that he was very interested in what he called therapeutics, which is why he was bringing up the drug, which makes this latest information I'm going to ask you about, I think, very concerning. Some researchers out of New York say that they were able to alter the coronavirus, a portion of the coronavirus, to, quote, mutate so that it became invisible to disease-fighting antibodies. So can we talk about what this says about the virus, why the ability for that to happen, why that would be concerning if our primary focus is on therapeutics or a vaccine?
So I think that the first thing is to say that the primary focus for this was antibodies. And so there are some treatments being developed right now that are antibody-mediated treatment. This article was very clear that this happens in a lot of viruses, basically every virus, and that it's not concerning for any of the treatments that we're looking for right now. What researchers are trying to do is basically think of all worst case scenarios. If this virus was to mutate in different ways, how would the therapies and treatments we're developing interact with it? Would it undermine those treatments? And I think what this really is more like a worst case scenario exercise in the treatments we have and the possible outcomes, not something we should be concerned about right now for the treatments we have or the virus, or more importantly, what we need to do, honestly, for preventative care. Remembering that the best way to not get sick from the coronavirus is actually not to get it in the first place, which means to continue to wear a mask, wash your hands, and stay socially distanced from people that you don't know.
Let me ask you about these two new studies published in the journal JAMA Cardiology. They're now providing some more insight into the impact that COVID-19 has on the heart. What do you know about that?
So this virus is brutal. We've seen it all the time. Some of my patients in the ER, when they come in, they look totally fine. You start running some lab tests and you realize that they are basically on fire on the inside. Their heart, their lungs, their blood vessels, their kidneys, it really does affect all organs. And we're going to see from specialists on numerous organs, I would say, whether it's the kidneys, the lungs, the heart, the brain, that there will be evidence of this virus having really detrimental effects on the body. We've seen now in the heart that there may be longstanding effects of the inflammation and honestly the scarring that occurs after having this virus attack, specifically in this case, the organ of the heart, and how it would affect the long-term effects of the heart pumping and what it would mean for patients in these, what we're calling them now as long haulers. Patients that have the coronavirus for a period of time get better, but now have residual symptoms. And that's the patient population that we're kind of talking about right here.
I'm really glad that you brought that up. It's just a reminder, Vlad and Doctor, that, when we hear things like this virus is, 99% harmless in 99% of the people, there's so much we don't know about the virus. And just because you were down for a couple of weeks with something that felt like a severe flu doesn't mean that there hasn't been damage that may affect you later on. So like you pointed out, the best thing to do is not catch it. And how do you not catch it? It's so simple. It's not about advanced science. It's about washing your hands, wearing a mask, keeping your distance. It's so simple. It's not that complicated.
It's actually, that's what I want to say about the press conference that happened yesterday, or a lot of the confusion around hydroxychloroquine. What we really need to make sure of is that we don't distract from what we know works, right? We know that if we were to stay home, wear masks, wash our hands, and take care of our neighbors, we would get this virus under control. And unfortunately, people don't really want to do that. Sometimes they want to just, if they want to take the risk, they're going to get it, take a pill and expect that they're going to get better. And that's just not the circumstance we're going to deal with this virus. And remembering that just because you don't die of the coronavirus, it doesn't mean it doesn't affect you, and it may not affect you for a long period of time. And I'm very worried about a new generation of chronically ill patients that are currently in their 30s and 40s that will be dealing with this for probably the next 20 or 30 years.
Some very good information there and analysis from Dr. Kass. Dr. Kass, thank you so much. We appreciate it.
Thanks for having me.